There's people that be like, we got to ban MMA because of concussion. It's not the concussion that's the problem. And I say this as a concussion researcher. I'm concerned about multiple concussions in a short time proximity. Because the research basically shows so far that if you get a concussion and you fully recover from that concussion and you get another one, it's just another concussion. You don't have this additive cumulative effect. But when they're back to back, within that temporal window of vulnerability, we call it, then you start to get additive and cumulative effects. Only about 10% of concussion injuries result in a loss of consciousness. And even a lot of doctors would say, well, if you weren't knocked out, you didn't lose consciousness, then you don't have a concussion. But actually 90% of concussions don't have any loss of consciousness. However, if you do, that's immediately at least a concussion, if not more serious, depending on how long that lasts. You get people that are in this perpetual cycle where they keep getting concussed easier and easier, and they're taking longer and longer to recover with each one, and ultimately they end up having to retire from their sport at age 16 because they've had too many concussions. Another thing people don't really get is that concussion is actually a treatable thing. If you have ongoing symptoms, we can actually treat that. You can fix that. A lot of people are just told, well, there's nothing you can do. You got to get, this is your new normal. Just get used to it. Learn to live with it. All that stuff is bullshit.
Dr. Cameron, please tell us, what is a concussion? I think that's a really good starting place before we start unpicking some more complex aspects of this.
Concussion is a brain injury. I think most people are aware of that. Brain injury falls into three kind of distinct categorizations. So you have mild traumatic brain injury, you have moderate, and then you have severe. That criteria is typically based off something called the Glasgow Coma Scale, as well as things like how long someone was unconscious or whether or not they experienced post-traumatic amnesia and for how long. So post-traumatic amnesia is someone who's asking continuous questions, why am I here? What happened? Why am I here? What happened? You tell them everything, and then 10 minutes later, they're asking you again, what happened? Why am I here? So that's post-traumatic amnesia.
Right.
So the criteria based on those things, Glasgow Coma Scale being kind of your level of consciousness, and your length of time of loss of consciousness, and your post-traumatic amnesia length of time, you kind of categorize things into mild, moderate, or severe brain injury, right? Severe brain injury would be somebody who's in a coma, unconscious for, days.
Okay.
A mild traumatic brain injury is the same as concussion. So if you're reading sports literature, they would define it as concussion. If you're reading neuro literature, they would define it as a mild traumatic brain injury. So concussion is a mild traumatic brain injury. Okay. Now, one of the other distinguishing features is that typically a mild traumatic brain injury will show no evidence of structural abnormality on imaging. So you can't see a concussion on a CT scan. You can't see a concussion on an MRI because the structure of the brain remains intact. So what it is, it's actually a functional injury. So it changes how the cells of the brain function for a period of time, and then that resolves. So concussion is one of those things that self-resolves, at least from a physiological perspective. Sometimes the symptoms can linger, but those symptoms tend to be due to other factors. Whereas when you get into moderate and severe traumatic brain injury, you're more likely to see objective neurological damage on imaging.
Okay. And just very quickly on imaging, is that what they call like spots and certain shading of different colors when they're looking at an MRI?
Yes, it could appear like that. However, there are findings of spots. For example, there's something called white matter hyperintensities.
Right.
And they will often correlate that or attribute that, I should say, to concussion injuries or previous concussion injuries. So you may have somebody that's had a series of concussions throughout their life, and they do an MRI just to kind of check to see if there's anything there, and they find these white matter hyperintensities. And someone may say, oh, these are due to concussion. However, the research on this shows that people with no history of concussion are just as likely to have these white matter hyperintensities.
Right.
So there's certain findings on MRI that often get attributed to concussion injuries. However, the evidence shows that they're not necessarily associated with concussions.
Right.
But typically, yes, what you would see on MRI would be evidence of damage, which would look like, spots, and it would generally correlate with the neurological findings. So if you have somebody that has, lost the ability to, move a certain part of their body, you would expect to see damage in a certain part of the brain, and that would correlate with the imaging findings.
Gotcha. I am going to hopefully come back to imaging, so I think it's quite a complex area. It's not something that I'm going to take a lot of this conversation to, but just to pay that off. But before we do that, you were talking about symptoms, and maybe I'm going to get this wrong by asking this in a certain way. You have to excuse my lack of specificity when it comes to this, but on a very general scale, what are the kind of symptoms that we most commonly would see with a concussion?
So a symptom is something that somebody feels, so they report that to you. A sign is something that everybody sees, right? So if you see someone get knocked out, everyone sees it. So that's a sign of concussion injury. A symptom would be someone reporting that they have headaches, difficulty concentrating, dizziness, nauseousness, feeling off or just unlike themselves, troubles with, focus, memory, that type of thing.
So the moment of impact,
yeah.
is that defined, like say you have a moment of impact and you lose consciousness, is that concussion right there and then?
Yes.
And it's the same thing? Right.
Yes. Now, it could be more than concussion, right? Because depending on how long the loss of consciousness is, you could be into moderate or severe brain injury.
Okay.
Now, only about 10% of concussion injuries result in a loss of consciousness.
Right.
So a lot of people might think, and even a lot of doctors would say, well, if you weren't knocked out, you didn't lose consciousness, then you don't have a concussion. But actually 90% of concussions don't have any loss of consciousness. So you don't have to have a loss of consciousness. However, if you do, that's immediately at least a concussion, if not more serious, depending on how long that lasts.
Okay. I mean, that's interesting. So we're sort of creeping into this area of misconceptions, if you will. So you've mentioned one there. Are there any other glaring misconceptions when it comes to concussions?
There's millions of misconceptions.
Okay, right, okay. What are some of the more popular ones that are troubling for you as someone as a specialist in this area?
Well, I think the loss of consciousness one is a big one, especially when people go to the emergency department experiencing all the symptoms of concussion, and someone, some ER doc might tell them that, well, they didn't lose consciousness, so they don't have a concussion.
Right.
And then obviously they don't follow proper protocols because they're under the assumption that the doctor knows what they're talking about, and therefore they don't take it seriously or whatever, and that puts them at more risk. Another big one is that they don't show up on imaging. So a lot of times you'll go to the hospital after a concussion, and they'll do a CT scan, and they'll say, your CT scan is clean, you don't have a concussion.
Right.
Well, the CT scan can't see the concussion. A CT scan is the reason why they do it is because they're looking for a skull fracture or they're looking for a bleed in the brain.
Right.
So because with a concussion, you can also get hemorrhaging in the brain. And that's really what they're looking for when they do a CT scan. But oftentimes, doctors will say your CT scan's clean, you don't have a concussion, but the CT scan is not even meant to pick up the concussion because they can't see it.
Right.
You're talking about a structural imaging modality, meaning it looks at the structure of the brain, and you're applying it to a functional injury that can't be seen on imaging. So it just doesn't make any sense. But I think it's just a lack of knowledge in the medical profession around concussion. Historically, it's been something that hasn't even been covered in medical schools, because it was always downplayed as a self-resolving injury that had no real repercussions. And so whatever,
Right.
unless there's something here that's really serious, we're not going to take it seriously. And that's just how we've historically looked at it. So it's only in the past, 5 to 10 years that things have started to actually be taken more seriously in the concussion space. So that's one, the imaging. Another one is that symptom resolution means concussion recovery. And that's just not the case. So we know that the brain takes longer to recover than the symptoms take to go away for the most part. Now, you get into people with PCS and persistent concussion symptoms. That's a whole different ballgame. We can talk about that too. But what I find, especially with athletes, is, and especially at the youth levels, where they don't have, trained concussion specialists readily available, they end up just going to some random GP. And the doctors will typically ask them, well, how do you feel? And they say and report that they feel fine, they feel back to normal. And the doctor will take that as, well, then your concussion has recovered and you can go back to your sport. But there's actually a kind of a tail on that. So the average symptom recovery takes about 7 to 10 days. The average actual recovery of the brain takes about 3 to 4 weeks. Some studies show as long as 6.
Okay.
Right? So the example I always use for this is something like a broken arm, right? If you break your arm, like, ow, it hurts. You go to the doctor, they take an x-ray, they can see it. Okay, the arm is broken. Put a cast on it, right? It hurts really bad. But then after about a week or so, the pain from that goes away. Well, just because the pain is gone doesn't mean that your arm isn't still broken. You can't cut your cast off and go back and get back into your sport. Your arm is still broken, right? So it's the same kind of thing. Just because you feel better after a concussion doesn't mean that the brain is healed. It takes some time, and it takes some time beyond symptom resolution. So I think that that's one big misconception that most doctors around the world don't understand. Most of them will just say, okay, well, if your symptoms are gone, that means the concussion is healed and you're ready to go. And that's just not the case. And I think that puts athletes at a lot of extra risk, because if you're still in the healing phase of the concussion injury, you're actually more susceptible to getting future concussions, and then they start to become cumulative over time. So then you get one, and now the recovery goes from, let's call it 3 to 6 weeks. It ends up being 3 to 4 months after the second one, if you get one kind of in that recovery window. Right. And then what happens if you get another one within the next 6 months? Well, now your recovery window ends up being, I don't know, maybe a year or so. We don't even know. We haven't done the research on it. And then what happens? Like, you get people that are in this perpetual cycle where they keep getting concussed easier and easier, and they're taking longer and longer to recover with each one. And ultimately, they end up having to retire from their sport at age 16 because they've had too many concussions, right? It's not too many concussions. It's that you didn't take care of the concussions when you had them. So, and I think that comes down a lot to the medical profession not having a good grasp of concussion. And so they're clearing athletes based on symptoms, and that's just really not how it should be done, right? We wouldn't clear a broken arm based on the fact that it feels okay, right? You'd want to make sure that it's healed before you let somebody go and do some high-risk stuff, and that's the same thing with concussion. But we don't have a good way of seeing the concussion, and that really comes down to the imaging side of things. We can't really see it.
So you touched on something. I think in my notes I've got a double concussion. So this is, I think this is what you're talking about in this instance, right? Now, I believe that I saw like an awful story, a tragedy where someone in rugby, I think it was even in the UK, maybe had a concussion and then came back. And then right. Okay. So had this like double concussion, which was obviously fatal. So a very important area which clearly needs addressing at a GP level. So if we can't see it with the imaging, do you guys know what's happening to the brain with the concussion, and then this repairing or system of repairing cycle, if you will?
Well, we only know what we currently know. So I can't just say that we know everything about it. Obviously, the brain is super complex. But from what we do know, it seems that what happens and what a concussion is, like if you want to get into the kind of physiology of it, is that it's a stretching of the brain. So it's due to acceleration, right? Okay. So it's not necessarily a hit to the head, it's acceleration of the brain inside the head. So that's why helmets don't really do anything, right? Because you could wrap the head in whatever you want, but the brain is still going to be moving around inside the skull. Okay,
right. So that helmet's just like a conduit at the end of the day.
A helmet is to prevent skull fracture. That's what the helmet is for.
It's not protecting the brain.
Yeah, so what the helmet does, if you think about, a sport like baseball or even MMA, you're talking about a lot of force being delivered through a small surface area, right? So if somebody were to get hit in the head with a baseball at a very high velocity, or even a baseball bat, that's a lot of force going through a small area. You're likely to crack the skull. But if you have a helmet on, what happens is that force now gets dissipated over a larger surface area, and it protects the. You might crack the helmet, but not the skull, right? So the helmet is designed to dissipate those forces to create a larger surface area of contact to reduce the amount of force transmission through a small focal spot. But underneath that helmet, if the head still does this, the brain is still what's sloshing around inside. So
Right.
it's the acceleration and deceleration of the brain. So you don't even have to be hit in the head to get a concussion. If you get a hard enough hit in the body, right? You think about a rugby tackle or something. If somebody gets hit in the body and their head whips back and forth, well, guess what's happening to the brain inside that head?
Right.
It's moving back and forth. I mean, I heard this one example that I thought was pretty good. But if you take, like a crash test dummy and you put it in a car without a seatbelt and you ram it into the wall, what's going to happen to the dummy? Well, it's going to bounce around the car, potentially come through the windshield and all that. Now, if you wrap that car in pillows and bubble wrap and everything else, what's going to happen? The car's still going to hit the wall and the dummy's still going to fly around inside. That's the same thing with the brain, right? So you can wrap the head in whatever you want. I'm sure there's some force mitigation, but it's very minimal. So helmets really don't protect against concussion, and this is another big misconception of people. Like, oh, I fell and I hit my head, but I wasn't wearing a helmet. And it's like, okay, well, that's bad from a skull fracture perspective, but from a concussion perspective, it really doesn't make much of a difference. What I was getting at anyway, when the brain moves around inside the skull, what happens to the individual brain cells? Their individual brain cells are these long kind of things called axons, and the axon is the long tail, but you have the full thing is called a neuron. But those axons get stretched. So if you picture the brain as being kind of a jello-like consistency, if the brain moves like this, the jello is going to kind of wiggle around like that, and all those individual axons are getting stretched. When they get stretched like that, it creates kind of a stimulation, so they get activated. So when you're sitting here listening to me and you're seeing me, all of this is causing electrical signals in your brain to have information go to the right places, and you can understand and you comprehend it. Now, when a concussion happens, picture all of your brain cells activating at the same time. That's going to create a lot of confusion. Maybe someone may go unconscious. They may see stars, right? They'll get all this kind of electrical discharge happening inside their brain, and so they may go off balance. They may have all these kind of signs and symptoms that go along with a concussion injury. That firing causes a number of kind of downstream effects. So that initial kind of impact that causes that firing, you may have kind of signs and symptoms for a few seconds, right? You might see someone stumble and be, off balance, but then they kind of smooth out and they're like, no, I'm fine. The concussion has already occurred. Even though the person says, no, I'm fine, everyone else saw it because that's electrical, discharge that's kind of overwhelming the system.
Right. So sorry to interject, but I'm just trying to translate this for like MMA speak, if you will. So someone gets cracked and they start doing what we call, maybe unfairly, doing the dance because they can't find their legs. Essentially, that's a symptom of concussion at that point?
A sign, yeah, because if everyone else can see it, right?
Now,
you have to distinguish between were they just hit and off balance because their weight had shifted,
right,
or are they actually unable to figure out what is level?
Yes.
Right. So it's kind of a different scenario, right? Like someone gets hit, they stand up and they're off balance after that. That isn't a weight translation issue. That's not a, your center of mass was knocked off and you're trying to just regain balance, because that happens too. Yeah. Right? A guy gets hit and stumbles back a few steps. That's not necessarily concussion. But if, they're unable to, they almost look drunk or something like that is an obvious sign that there's been some neurological insult. Right. We should know where the ground is. We should know kind of what our surroundings look like. So anyway, there's been a neurological insult. Now that smooths out and people go, oh no, he's fine, ready to go. Right. But the concussion has already happened.
Right.
But then the downstream effects of that start to take place over the next few hours to days to even weeks is that that electrical firing causes the energy levels in the brain to drop. So the energy molecule in our brain is called ATP. Now, I won't get into all the physiology of how this happens, but essentially our ability for the cells in our brain to produce ATP, to produce energy, is impaired. So we're producing less energy than we're using. So what happens over the next few days is the energy levels within the brain start to really drop. And then they hit a peak low, let's say around 5 to 7 days, and then they start kind of gradually regaining back up. And we see them get back up to normal levels around that kind of 3 to 4 week mark.
Right.
So what we know is that the most dangerous time is when that energy is low. And if I say that it's, the peak low is around 5 to 7 days, that's typically around the time when symptoms go away for most people. So now, if we're relying on symptoms to make our return to sport decision, and athletes say, you know what, I feel better. I took a knock on the weekend, but it's been 5 days and I'm feeling pretty good. They're actually at the worst possible time to go back in. Because if you're already low, if you get hit here, well, guess what? Now you're going way down here.
Yeah.
And at some point, when you hit low enough kind of ATP levels, the cells of your brain cannot function to the point where they actually die off. So now you're creating permanent neurological damage, not because of a concussion injury. And this is the idea behind second impact syndrome. So this is kind of like the Ben Robinson case that we were talking about, is you get a concussion, right? And then, you go back and play. Even a week later, you're actually at the low point. You get hit again. Now you get this massive kind of swelling that happens inside the brain, and it can be fatal. Now, second impact syndrome has only ever been shown in people under the age of 18. So it seems to be something about youth that is more dangerous. There's never been a reported case, as far as I'm aware, in adults. But even if you're not necessarily going to have a fatal outcome, what you're doing is creating a cumulative effect. Because now, if let's say your max is up. I'm trying to get on the camera here. Let's say this is normal levels, right? After a concussion, you have about a 20% drop. Right? 20% drop is recoverable, and it just takes a few weeks and you get back up to your normal levels and everything's fine. However, if you're down here in the low level and you drop again, now you're going to about 50% of your ATP levels.
Right.
And at that point, the cells don't even have enough energy to maintain their own life, and they go through a process called apoptosis, and they actually die off. So now you've created permanent damage. Now the recovery, think about how long now it takes to get back up all the way to normal from down here. Now that's a 3 to 4 month period. So what happens when your symptoms go away? The second time, you still have a long period of recovery after symptom resolution. People don't know that. It may be 2 to 3 months after your symptoms go away from that second concussion that you're actually okay. So in that 2 to 3 month span, what's the likelihood that an athlete goes back and starts participating in sport? Probably pretty high. Yeah. Now what happens if they get hit again? Now they're way down here. Now you're creating this cascade of effects where you can't get out of the hole you've dug for yourself.
Yeah.
And that's really the big thing. So our mission is to try and use more objective measures of brain recovery. And we do this through something called baseline testing. So baseline testing is where you take athletes prior to a season or prior to a competitive event, and we test them on their cognitive function. We test them on their reaction time. We test them on their visual function. We test them on their balance. We test them on a whole bunch of different things. So we get a good idea of how you function as an individual, right? Because if I were to take everyone, even at the highest level of MMA, you're going to have people that have different reaction times. You're going to have people that have different balance. You're going to have people that have different cognitive function. You're going to have people that have different spatial awareness abilities and whatever else. So we can't just use what's called normative data, because everyone's so different, right? Like, let's say you have exceptional reaction time. If I'm comparing you to a norm and you're normally better than the norm, but right now you're at the norm, are you recovered? No, you're not recovered to where you were. But if we use just norms, it doesn't work because everyone's so different. There's so much variability. So we try to get a good sense every single year of where athletes are at right now. And you should actually even do it more frequently, to be honest, but trying to get people to do it every year is already an uphill battle. But if we could get people to start doing it every year, and then probably every 6 months or so, is to just almost do like a physical where we run you through all these things, we have your results, so that if you get concussed, then when your symptoms go away and you're saying, I'm feeling better, we can say, okay, let's see how it's our x-ray, right? It's our x-ray. But the problem with it is you need people to be a little bit proactive. Right? This is something that honestly should be mandatory in most sports, just because it just kind of gets that information there, and it allows us as healthcare professionals to make better decisions. We're not just relying on self-reported symptoms. I mean, athletes lie about that too, right? Even if they're not feeling good. But even if they're being 100% honest, symptoms do not line up with brain recovery. So we need something better to see it. We can't see it on imaging. It doesn't work. So you need to test function. And the only way to use that for any good is to know what the function was pre-injury.
Yeah.
And so that's kind of how we use that to assess that, to try and prevent that, to prevent people from getting into this doom cycle where they get a concussion, then they get another one, then they get another, and now they're screwed. because they've had too many, but it's not too many. It's too many close together before the recovery of the prior one.
Right.
So in youth, that can be fatal, right? And in adults, it just leads to more neurodegenerative consequences and issues.
This is going to be such a challenge. I'm just thinking about this from the sports side, and I'm most closely aligned with combat sports. And I look at the science there. I've said this before to other sort of performance specialists, if you will. I did a season of triathlon, and I was blown away by the science in triathlon, but it got me quite excited for what could translate over into mixed martial arts, even like hydration stuff. I typically would work out really hard and just a bunch of sweats all over the mat, and I'm just chugging water. Whereas in triathlon, I've got electrolytes and salt sticks, and I mean, they're cheap and it's easy and it's a proper way to hydrate. And I'll come on to sort of maybe some weight management hydration stuff as well, because it does affect this area as well. So I'm excited what we can do, but I also know the resources, especially in a sport like mixed martial arts, particularly at the lower levels of maybe youth and early seniors, if you will, they're just not there, and the expertise certainly isn't. So, I'm just trying to think how we're going to roll this out sport wide. Or do you have any ideas on, apart from, of course, the sort of the courses and things that you have? But this is a challenge that I'm sure you're facing because you're passionate about the health. So what can we do collectively to try and push the sport into getting people on this kind of baseline programming?
Well, I mean, I think you're right. I think it's a bit of an uphill battle. It requires more awareness. It requires more education. If people don't know why they would do it, then there's no real reason to do it. Or if they don't even know it's an option or don't understand what the premise or idea behind it is. But if you were to explain it to people, to say, look, we need to know when brain recovery has occurred because this will actually protect you and actually give you more longevity in your sport, right? You'll be able to participate and compete longer. But what we need to make sure of is that if a concussion happens, right? And I'm not one to try and change sports. Like there's people that be like, we got to ban MMA because of concussion. It's not the concussion that's the problem. Like, and I say this as a concussion researcher. I'm not concerned about concussion injuries. I'm concerned about multiple concussions in a short time proximity. Because the research basically shows so far that if you get a concussion and you fully recover from that concussion and you get another one, it's just another concussion. You don't have this additive cumulative effect. But when they're back to back within that temporal window of vulnerability, we call it, then you start to get additive and cumulative effects. So if people understood that the reason they're doing this is to protect themselves from, having to retire early. That's actually going to give you more health and longevity. It's going to reduce the likelihood that you're going to get knocked out in your next fight because you fully recovered and you're not in this vulnerable place. So all of that stuff I think can be framed around even performance and career and that type of stuff. So I think the education piece is big. Now, the other factor, resources, money, financial, if you wanted to do a full kind of baseline protocol with us, it would probably cost you between, I'll use British numbers, but maybe like 60 to 100 pounds.
Yeah, that's not a lot of money.
No, and it's every year. Okay. Yeah. So, okay. And, groups could make this, like gyms could make this part of their registration. This is a requirement, right? Insurers could make it part of their liability thing because people are getting sued these days, right? Like I think the RFU is currently in a lawsuit from rugby players saying, negligence and everything else, right? So this is only going to get worse, but this is something that somebody like RFU could do to protect themselves to ensure that they've had protocols in place, right?
Yes.
And the other thing that we've done, for example, is we've created an app, right? Anyone can download it. It's called Concussion Tracker. If you want to go to the Concussion Tracker app, you'll see this logo on the app, and we have free, unlimited neurocognitive and postural sway testing inside the application. So anyone downloads it, they make an account, they can do a neurocognitive test, and they can do a postural sway test. We're currently adding another tool for visual tracking. So it uses the camera to pick up the eyes, and there's a dot that moves on the screen, and it tracks how accurately you're able to follow that dot and how quick your eye reaction time is to that dot moving and changing directions. So that's another piece that we're adding. So these are all tools that are freely available that is an easy on-ramp, right? So if, let's say, the governing bodies in the UK were going to say, okay, we want to start somewhere. This is a free tool. You can't claim resource issues when there's something that's free. Now they may not know it exists, and so this, hopefully they hear this and they realize that, because, and then the second part of that is you need trained healthcare providers in order to understand how to properly manage this, right? So our mission right now, we're the largest concussion care organization in the world. We have about 450 locations right now worldwide. We have, between the UK and Ireland, I think we have about 15 or so clinics that are coming up. We're growing all the time. So the idea is to try and create a network of clinics, and these all pair with the application, by the way. So you could do this free application, do your free baseline testing. In the event of an injury, the app can actually be used as a screen. So you could have a coach or a trainer pull up the app, run a quick screen on somebody. It'll compare directly to their baseline results. And then it'll also tell that person, it'll give them a bunch of instructions. Here's what you do overnight. Here's when you go to the hospital, right? What types of things mean that you should go to the hospital? What types of things say that you don't necessarily have to? They can take that injury report to their GP if they want, or if they want something a little bit more robust, they can find any one of our clinics, book an appointment, and then that clinic can take them through the proper process. So that's kind of the idea, is just to gradually grow that network of clinics so that we have certified, trained concussion experts that are helping people to do this. We have free tools that can be used as just an on-ramp for people to start doing something. Now, it's not as good as a full, robust thing, but it's something. Yeah. And having a little bit of something is better than having nothing at all. And so, yeah, there's issues with resources, but we're trying to mitigate that as much as possible just to try and make things freely available for people.
Yeah, love that. I'm gonna give that a go. I'll share something personal here. So I did some testing, some of the eye testing that you spoke about, but I also did this one where I marched on the spot and closed my eyes. And I actually got stopped after 30 seconds because I'd already done 180 degrees. Like, I have literally no balance, but I'm certainly losing my sense of direction far too quickly for a man of my own age. So I've got to do some work with a specialist physiotherapist to get it right, but it's actually a pretty gnarly process to go through because they put you in those situations which kick off some symptoms. I get quite nauseous. So anyway, even like I'm not special, and I've certainly got. I'm not saying this is related to concussion, by the way, but there's stuff going on in all of us, right? And I think some baseline testing, if you're in this contact sport world, is definitely worth doing. I like that. Now,
can I share my screen?
Yeah, I think so.
I'll just share this. Oh yeah, I can. Okay, hold on. I'm going to share this right here. This is just interesting. So this is our neurocognitive test. Now, hold on. Let me stop sharing for a second because I'm going to ask you a little question.
Oh boy.
So this is our neurocognitive test. Okay, so we put it out. It's freely available on the application. Mm-hmm. We have people that have done baselines, and this is validated baseline. So meaning that if you try to fail the test, it'll catch you. So some athletes will try to get a poor baseline result, so that if they get a concussion, they can make it seem like they don't have one.
Right, gotcha.
But we have criteria inside, like algorithms that will pick up if somebody's giving a good effort or a bad effort or whatever. So this is only the validated test. So we know that this is good test data, and we have it from age 12 all the way up to age 75. Okay. When do you think cognitive decline starts to happen, right, in a normal population? Like, when do you think people start to get slower and,
Well, I might have this very wrong, but this is an area that I've looked at before, and I might have my thing twisted up, but is it not something ridiculous like 30 or even younger? Things start falling off.
Yeah. So I always was under the impression that cognitive decline probably starts to become, a thing around 50 or 60 years old, right?
Right.
And we pulled all the data. So this is 30,000 tests.
Okay.
of all different ages, and I'll just share this with you because it's actually quite crazy. But this right here, so this is 12,
Right.
all the way up to about age 20.
Right.
And then we kind of stabilize and plateau until about age 27. You can see the ages here.
Oh my
27, goodness. And then you have a pretty big decline, and it's pretty much a straight shot. There's a couple of like little plateaus you can see.
Yeah.
Like here's a little plateau between about, 35 to early 40s, and then after about 43 you start the decline again. And then you get to about 50, and then you have a little plateau again till about 60, and then you're on the decline again. But you basically improve until about age 20, plateau, and then from about 27 years old and on, you're declining. This is a combination of all tests. So this is procedural reaction time, spatial awareness, impulsivity, all these different kind of cognitive measures.
Right.
And this is a ton of data, but like I was shocked. We just pulled this, so that's why I'm like, holy crap.
Thank you for sharing that. That's pretty
incredible.
Frightening in a way, isn't it? Pretty.
Yeah.
But well, it goes against what most people would think is, when you retire, when you slow down, we have this with our parents, right? When they retire, when you retire, you've got to keep doing stuff, otherwise you're just going to start falling off. Well, you've been falling off since you were about 27, apparently.
That's right. That's right. But what's interesting about this, right? If you take someone like yourself that, okay, I've had a bunch of concussions in my career, I'm concerned about neurodegeneration, okay? You can now do this test and it'll tell you, are you in line with what's normal? Because there's a lot of fear. There's a lot of fear from people, right? Some of it very unnecessary fear around, CTE and neurodegenerative stuff and whatever. But it can tell you like, hey, I'm actually right on track. Like I have nothing to worry about. So it could be something beneficial, or actually I'm coming in below. Maybe I can do some things to improve.
Yeah.
Anyway.
Yeah, no, I like that. That's definitely something we should all be taking a look at if we're involved in the sports. Now, I don't know if this is going to be almost unfair for me to bring up, but I'm kind of going to do it anyway. So it's about just under 15 years ago, I got involved in a safety initiative within the sport of mixed martial arts here in the UK, and we were looking for just baseline health testing. There's some costs associated with getting what we really wanted, but we were really just doing bloods and a physical examination. Then we started trying to push the idea of, was it MRI, MRA? There's like two versions of a scan, but it was just not really something that we could put on the athletes who were they were basically paying to play, if you will. But another issue that we had was the ability to find the necessary expertise to even read those scans to make an educated assessment of whether or not there were any issues. Is that still an issue in 2024? As it like the expertise of someone looking at a scan and differentiating between what could be potentially problematic and someone who's good to go?
Yeah, I mean, I think it really comes down to the radiologists, right? So different radiologists will have different expertise. Like, for example, a couple of years ago, probably about 10 years ago now, there was a group in Italy that was publishing research using something called magnetic resonance spectroscopy. And what this does is it actually picks up ATP, like a correlative ATP, not ATP, but something that mirrors ATP levels.
Okay.
So if concussion is an ATP deficit, the research that shows that 3 to 4 week time period for recovery, that's done on magnetic resonance spectroscopy.
Right.
So we can actually see, because you can't measure ATP. You have to measure something different. So they measured this molecule called NAA that correlates very strongly with ATP. So as ATP levels drop, NAA drops. As ATP levels rise, NAA rises.
Okay. So
you can kind of get an idea of what ATP is doing by looking at NAA. So they had they ran this study using magnetic resonance spectroscopy, and they were able to basically see concussion and when it had recovered. And so I reached out to them and I said, hey, like, this is fantastic. How can we kind of get this going? And he was like, the the issue isn't necessarily the technology in terms of the MRI machines. It's having the radiologist be able to interpret the results. And at the time, I was actually working with a medical radiologist. And I said, hey, like, you guys considered doing anything like this? And he's like, we just don't have the resources or the radiologists that are, trained or experts in how to read this. So there are things that could be done. But again, you're talking about many health systems that are completely overburdened. Yeah. Right? Like in Canada, at least, like if you want an MRI, it's going to take you months to even get it. Yeah. And they're only going to let you have it if there's something really seriously, of concern that they want to do it for. So I think it just comes down to there's issues with cost. I think that not every radiologist knows how to interpret the results of some of these scans. And so you have to find somebody who's more specialized in it. So there's a lot of different barriers to it.
Yeah, yeah.
That's why I think the idea of like, let's forget about the scans. They don't really add much value anyway, unless it was something like spectroscopy. But instead going for objective from a concussion perspective anyway. Right, I mean, from an overall health perspective, obviously you're going to want MRI for structural injuries and things like that. You're going to want it to look at brain bleeds and things like that. But in terms of concussion injuries, I think like going with functional testing is definitely the easiest path.
Yeah, and I don't want to throw athletic commissions under the bus here, and I'm certainly no expert on what they bestow onto a fighter that has suffered what they perceive as a concussion. Certainly they've been knocked out. They get like mandatory time periods. So I'm not sure if it's 45 days. I'm pretty sure I've heard of a 90-day. But it's interesting, isn't it? I was actually listening to a podcast earlier where there was a boxing coach. Their student got knocked out, and it was a famous guy. I'm not giving you all the right information here, but he said to his student, "You're not going in the ring and sparring for another year." But it's interesting where we just pick up these time frames from, right? And if we had the necessary testing in place, a baseline, and then some metrics that we could measure against, we could give these guys and gals back their time in competition, or save them from delays in their performance as well as their injuries.
Yeah, I mean, I think that in certain sports, a mandatory time removal after a fight, regardless of the outcome, I think is good.
Yes, I agree with that.
Because, like, for example, if the time period for concussion recovery is between 3 and 6 weeks, I think just saying that you can't fight within a 3 to 6 week period after your previous fight. I mean, 90 days, okay, great. Now, the question, though, is, are they still training during that time? Are they still sparring during that time? Are they still subjecting themselves to head impacts during that time? Right? What it would be probably better in a sport like MMA or boxing is that after a match, you don't do any type of sparring where you're going to get hit for that first 3 to 6 weeks, and then you can start getting into training again, because that just automatically removes the idea that like I need to hide my concussion symptoms so that I can continue training and whatever. But if it was just kind of part of the sport where it was like, okay, we can only fight every 90 days, and for 4 weeks after every fight we can't do any contact sparring, and that just becomes part of the process, I think you really cut down on the risk of repeat injuries, and you cut down on the risk for even CTE and things like that, because you're actually allowing the recovery to take place, concussion or not, right? Even what if the subconcussive impacts are causing something? We don't really know, but what if they are? I think it's a good idea to have that. Now you look at a sport, like soccer or rugby. They've come out and introduced like a mandatory, I know in Australia at least, it's like 21 days, right? If you have a suspected concussion, you're out for 21 days. The problem with that is that athletes already don't want to report a concussion if they think they're going to miss the rest of the current game.
Yeah.
Right?
Yeah.
They already are hesitant to report. Now you come out with a mandatory, it's going to be 21 days now, no matter what. Yeah. They're going to be even less likely to report. So now you're actually potentially going to pick up less concussion injuries and increase the risk, because these guys are going to want to keep playing throughout. They're not going to tell anyone. Nice. And it makes it even more difficult. So in sports like rugby, I would rather get rid of the mandatory time commitment and say, we're going to have objective testing, and you're only going to be cleared when you're ready.
Right.
It may be a couple weeks, it may be 4, we don't know. Everyone's a little bit different, but at least now we're making that decision based on, the actual person's recovery timeline. Like, I think with a sport like MMA, it's like you can separate your fights well enough that you can do this in a very systematic and controlled way. So to me, the mandatory time requirement in MMA would be a no-brainer. I think it makes sense. Boxing, same thing. But with a sport like rugby or soccer, I think it's a bad idea. Like, I actually think we should remove that and have a better return to sport process.
Sure. From having listened to you speak about this subject before, there was something that was very interesting to me, and it was getting people back. And I think that the old school notion was sit in a dark room if you're feeling like you're a bit giddy and don't do anything, just stay sedentary. But your research and findings and the work that you're doing sounds like it's something quite different, which actually I think is more positive for athletes because you want them to get back to movement.
Yeah. Now, I want to clarify, this is not my research. I just read the stuff.
Right, gotcha.
But this was actually pioneered by a group in Buffalo, a guy by the name of John Leddy and another guy by the name of Barry Willer. And they're at the University of Buffalo. I actually did my research with them when I was doing my sports medicine fellowship. So they were the ones who kind of pioneered the idea of exercise. And at the time, and this is only maybe 10 years ago, at the time, it was difficult for them to even get ethics approval to run a study on exercise in people with concussion because it was so ingrained in people that, well, you have an energy deficit in the brain. And so you need to rest to restore that energy.
Right.
But the problem, though, is that with a concussion, you also get other issues. So with a concussion, you also get autonomic nervous system dysregulation. So your autonomic nervous system controls all the automatic processes in your body, right? It controls your heart rate. It controls your breathing rate. I mean, breathing you can overcome and you can do your own thing, right? You can consciously change your breathing rate. But if you're not thinking about it, your autonomic nervous system just does it, right? It breathes more when you need more, and it breathes less when you need less, and it's slower or faster or whatever. It controls your digestion. It controls your gut motility. It controls how big or small your pupils are, how much light you're letting in, all that type of stuff. So with concussion, you get dysregulation of the autonomic nervous system. Typically, you have two sides to the autonomic nervous system. One is sympathetic, which is your fight or flight. Right? The bear is chasing you, your pupils dilate, you're able to hear more sound, the blood flows to your muscles so that you can run, right? Other people freeze, right? I don't know what to do, I'm in shock. So that's fight, flight, freeze. That's kind of the sympathetic system. Then you have your parasympathetic system, which is you're calm, you're relaxed, your digestive system is working, right? So they call it rest and digest. So that's your parasympathetic system. After concussion, typically people get stuck into a sympathetic state where their nervous system is hyperactive. Now, what we see is after concussion, this happens, but the way to boost your parasympathetic nervous system is actually through regular exercise. So when they first started introducing this, it was difficult for them to get ethics approval. So they only would allow them to do it in people that had had symptoms for a few years, right? Well, rest isn't working. Nothing's working. Can we do it on these people? And they're like, sure. So just by instituting exercise in a certain way, you can't just go exercise. You have to do it in the right way. If you do it too hard, it makes it worse. Okay. So you have to do it in the right way. It should be guided. When they did this protocol, 70% of people had a full resolution of symptoms and they were symptomatic for years, and they just started exercising, and boom, their symptoms go away. Exercise is good for your mental health. It's good for your autonomic nervous system. It's good for lowering inflammation. All the things that cause some of these symptoms, exercise is beneficial for. And so then they started getting approval to do it earlier and earlier and earlier. The most recent study, they're now doing exercise as early as 2 to 3 days after the injury. And what they're finding is that it reduces the chance of persistent symptoms by almost 50%.
Wow.
So the current rate of persistent symptoms, if you get a concussion and you're just told to do nothing and just wait, it'll go away, 30 to 40% of the time, you're going to still be symptomatic after a month. If you did one thing and you did this proper exercise protocol within a couple days of the injury, that drops in half. So now you're at 15%. right? And now there's other things you can do like vestibular rehab and get neck treatment, change your diet a bit, start eating in a very low inflammatory way. I mean, most MMA fighters are good at this. They're very good on nutrition, better than almost any other sport. So that's a good thing. They're usually coming into the process pretty good. All of that stuff, like our data with our clinics shows that the rate of PCS or persistent symptoms is less than 5%. So you can you can knock that out and make it that 95% of people recover very quickly. So anyway, exercise. It has to be done the right way. It should be done fairly early on. So now the current protocol is after a concussion, it's no more bed rest. It's no more dark room, right? Screens, the typical advice on, or the current advice on screens is that you don't need to fully avoid it, okay? The people that do the worst are people that fully try to avoid screens and those that don't limit it at all. So what they say is kind of moderate reduction in screen use. So you can still go on your phone, you can still check some emails, you can still do that. They want you doing some light cognitive activity. Like I typically say, do some household chores, make sure you get outside at least a couple times a day for a 15-minute walk, just outside, just a nice light walk within the first day. You can do a little bit of reading, you can, socialize, whatever. You can check a few emails, but just take it easy for a day or two. And then after that, we start pushing people back into cognitive activity, gradually building them up. And then exercise, we actually put them on the treadmill and we try to figure out what their capacity is. So we put them on the treadmill, we start them going, and we gradually increase the incline every minute so that their heart rate raises very slowly and gradually. And what we're looking for is, do you feel worse with this? If you don't feel worse with it, that means that your autonomic nervous system actually is quite regulated. So then we allow you to go back into non-contact training at that point. If you have issues with it, then we give you a specific exercise protocol where you're working below that threshold, right? So if you get to a heart rate of 150 and you're like, oh yeah, I'm starting to feel really bad. Okay, 150 is too high. Exercise is good, but 150 is too high. We take 80% of that. So we put you down at let's say 130. I want you exercising every day at 130. And you come back in a week and we retest. Now you're up to 170 before the symptoms start. Now we put you at 150. So now you exercise at 150 for a week. Then we get you back in, you pass. You're able to get to full exertion with no issues. Great. Now you can go back to non-contact training.
Gotcha.
So it's getting people activated early, initiating rehab early, and you actually reduce the chances of a prolonged outcome substantially.
And also athletes, they just need goals, right? I mean, it might not be exactly what they're after, but the fact that you're giving an athlete numbers and a goal, I think it's still going to tick some boxes in a way. They feel like they're moving towards something in the right direction. Yeah. Hopefully they're getting, they see this progression rather than regression with these results. So I think that's a really positive thing.
Yeah, if you tell someone that there's nothing you can do about this, just wait.
Yeah,
they're gonna develop anxiety around that. They're gonna bed rest alone creates autonomic dysregulation.
Okay.
So if you put someone with a concussion who already has autonomic dysregulation, you put them on bed rest, they're going to have a further autonomic dysregulation. It's going to make it much more difficult for them to recover. It actually makes them much worse.
Yeah.
So you want to get people up, moving around, moving their body, getting their heart rate up a little bit, but you have to do it in the right way. The problem with athletes is that they're the type A's, they're the pushers, right? So there's two types of concussion patients. There's the people that are very fear avoidant. Well, I don't want to do anything that might trigger my symptoms. They don't do very well. But then you have the type A, they're like, I'm just going to power through this, and yeah, I got a headache, but screw it, I'm doing it. They do bad as well.
Right.
So we have to find that kind of happy medium. We have to take the people that are the type A pushers and we have to rein them in a bit. People that are the fearful, I don't want to do anything that might make it work, you got to push them a little. So it's kind of that balance.
Yeah. You were touching on a couple of other bits as well, and I'm just trying to think of some other positive notes to share with the MMA community, if you will, in terms of trying to stop knockouts, etc. I know neck strengthening, so structural stuff, and maybe nutrition. Are there any protocols or any pieces of advice in terms of a more preventative sense that you can share with us?
Don't get hit.
There's that, of course. Yeah, I mean, do you know what? I think I'd thought of that. But apart from not getting hit, what else can an athlete do? I probably should have front-ended it with that.
Preface that. Yeah. No. So neck strength is a bit challenging.
Right.
So the idea behind neck strength, maybe I'll start there. The idea behind neck strength is that because concussion is an acceleration-deceleration event, studies that have been done in animal models, for example, they've done a study on cats that's just hilarious. Unless you're a fan of cats, then you might find it a little bit cruel. But just the way they did this study, what they would do is they would take a pendulum, so they'd put the cat in this spot, and they'd take a pendulum, like a weighted object, and swing it down and hit the cat and give them a concussion injury, right?
Okay.
And the quote that's funny, and I'll tell you what it is after, but then they stabilized their neck, so there was no neck movement allowed at all. Because if the neck doesn't move, the head doesn't move, right? So the only way the head moves back and forth is if the neck allows it to. So if they make your neck a complete, stiff, rigid object and there's no movement available, the quote is, concussion could not be obtained even with the maximum velocity obtainable by the pendulum. So you just picture these guys just trying to real swing this thing down, and they couldn't cause a concussion injury. Right. Meanwhile, you take that device off the neck, concussion occurs. So the idea was, let's strengthen the neck. It's a good thought, okay? Now, most of the studies on neck strength are done in more dynamic sports like football, where people are getting hit, when they're not looking and paying attention, right? They're looking over their shoulder, they catch a pass or whatever. And neck strength doesn't work. And the reason, or my speculation as to why it doesn't work, is the time. So when you look at concussion forces, the head or the brain hits peak linear acceleration within the first 6 to 20 milliseconds after impact. I'm talking about like NFL style football. Okay. So American football. The head hits peak acceleration in the first 6 to 20 milliseconds after impact. It takes, and this is looking at biomechanical studies, how long does it take someone to contract the muscles in their neck? It takes 90 milliseconds to even initiate contraction of your neck.
Right.
So even if you get 6 to 20 milliseconds, by the time you actually contract your neck and use all that strength you have, it's already happened. Right? It takes another 150 milliseconds to get to half of your contractile strength. And then it takes another 150 milliseconds after that to get the full strength. So you're talking about you need a good half second to contract your neck before impact for it to have any effect. So neck strength may be effective if you see the hit coming. So in a sport like boxing, where you're face on, having a good contracted, strong neck with a lot of endurance is a good thing. Okay? But in a dynamic sport where you're turning and looking around, you can't have your neck contracted all the time, because otherwise you'd have to turn your whole body just to see where things are. And it doesn't work, because usually it's the person that gets hit that doesn't know the hit's coming.
Yeah.
Right? Whereas if you're running at somebody and you have a half a second, you're going to get out. You'd rather get out of the way than take the hit. Yeah. And I think that's probably a better strategy, is if you have a half a second, don't worry about neck strength, worry about visual awareness, get really good at knowing where everyone else is on the field, understand your surroundings, right? And I think that's more protective than anything. But in a sport like boxing, MMA, when you're kind of, looking straight on, yes, having yourself engaged and ready to go and having a good, strong, stable neck with high amounts of endurance can be effective. Because what the conflation is that, yes, when you stabilize the neck completely, the no concussion occurs, but neck strength and neck stability are two different things. In order to have neck stability, you have to have a strong neck that's actively contracted, which means you have to have at least a half a second.
Right, to see it. Is this going to be unfair of me to ask you about why some guys have, quote unquote, a better chin than others when it comes to taking shots? Is that something that you can answer?
Not really. I don't think we know. I think there's a few potential things. There may be genetic factors.
Okay.
Right? There may be genetic factors. There may be neck strength factors. Right? There may be the ability to stabilize. There may be spatial awareness factors.
Okay.
Right? If somebody's got really good peripheral vision, and it might be reaction time factors. There could be a whole bunch of different things that weigh into that. One possible theory that I've really considered is this idea behind the vulnerability and letting concussions recover.
Right.
So it's, let's say you get knocked out, and then you don't take the amount of time and now you get injured again in training, let's say. So now you've had the 2. Now your window is this long.
Yeah.
And your next fight is scheduled for 90 days. You're still in this vulnerable state, which means you could potentially get a concussion easier.
Yeah.
Right? And so maybe they're in that vulnerable window, they get hit again, knocked out. Now the window of vulnerability now stretches, let's say, to 365 days. Well, they're going to have several fights within that period, and they're all in the vulnerable state.
Yeah.
And then done. So now it's like, well, they got the glass jaw, right? They're not able to take the hits. Well, is that actually a result of improper management earlier on in their career?
Right, gotcha.
That's a question.
Yeah. I'm conscious of your time. We're just creeping up on an hour. Are you okay for another 10 minutes or so? Great. Yeah. I'm really enjoying this. Thank you. I think I'm really learning a lot, and I know a lot of other people will as well. I'm doing some work in and around the amateur scene at the moment, and the International Mixed Martial Arts Federation has said that they don't want to see anyone under the age of 18 in a headshot bout. So all competition, like on a world level, under the IMAF rules, if you will, everything is without headshots. Now, I think this is more of a direct question, so I think I know what your answer will be from earlier. You said and shared that awful situation where that young man died, and he was a minor, essentially. Do you agree with this kind of notion that in mixed martial arts, I know you do work across a lot of sports, but this is what I was asking about, kids shouldn't be getting punched in the face? Because you've just said there's a physiological or certainly a brain issue that isn't certainly showing in adults, but also, I guess, the development of the brain, it doesn't seem like it's a good thing to do.
Yeah, I mean, it's actually interesting. I didn't know that. I didn't know that they were banning headshots.
Well, the difficulty we have in our sport, not a lot of regulation. In America, they have the athletic commissions.
I don't know why I'm getting thumbs down signals happening behind me.
Oh, is that right? Sorry, I think it's AI for you, isn't that wonderful? Yeah, different commissions have different rules, but IMAF is trying to set this precedent. And again, the education out there, I think the British Boxing Board of Control, for example, say not under 14, but from 15 years old, you've got kids in full-on headshot bouts. So I'm learning about this as well, and I'll go by data and what the scientists say, because again, we're learning all the time. I think you said earlier there's a lot of progression in the last 10 years. So yeah, just your thoughts on that and why it might be a good thing to stay away from these sorts of contacts before the age of 18. Yeah,
I mean, I actually like it. I actually think it is a good idea. And there's a few kind of precedents that are set before this. So in hockey in Canada, right? So I'm in Canada. Hockey is obviously a big thing. We used to start body contact at the pee-wee age level, which is about 12. That's when body contact started. And a few years ago, in certain leagues, they moved it up to bantam, which is 14, and that's where hitting would start. Now, when I first heard this, I thought this is a stupid idea, because at age 14, you have some kids on the team that have, a mustache and they're 6'2", and then you have the little 4'9" kid that comes in and is like, "Hi, yeah, I'm Johnny."
That was me. Yeah.
and I'm like, so now you want to put hitting in now?
Right.
When now you have this size discrepancy. In my mind, I thought, let's move it earlier. Let's put it down to, when they're 7 and 8 and they're all the same size, right? Let them learn how to skate with their head up and how to take a hit properly. And maybe that'll actually reduce concussion risk.
Right.
Now, I will say that I was wrong on that. Because when the data actually came out, what we did see is we saw increased concussion risk in bantam, but we saw a 60% concussion risk reduction in the 12-year-olds. Now, from a brain development standpoint, kids are actually more susceptible. The research shows that if you're in kind of late high school, so if you're like 16 to college age, the amount of force required to cause a concussion is between 70 and 120 Gs. But for 11-year-olds, it's only between 30 and 60 Gs. So they can get concussed with less force, and because the brain is still developing, what does that do to that development? Does that create issues because the brain is still in its developmental stage, and causing these injuries that early on changes how things get wired, changes how things develop, right? We don't have full myelination of the brain until about age 25, right? And just like I showed on this graph, it's about the time you start to actually decline.
Right.
You peak out and then decline.
Wow.
But I actually think that's a really good idea because it allows more development of the brain to occur. And what's interesting is that in the bantam age, so I'm using the hockey example here because that's where a lot of the data is. In the hockey example, I was concerned that it would ruin the performance of athletes coming into bantam, right? Because they didn't have that skill set developed, and there was no performance deficits. There was a slight increase in injury risk when they did involve hitting, but it wasn't the same as the reduction that happened by removing it. And the same thing's happening in U.S. football. There's a big push to make tackle football only 14 and older, and then do flag football for 14 or for under 14. I think that's a great move because you still learn the game. You still learn the foundational elements of the game. You still learn how to play it, right? And with MMA, you don't have to necessarily hit in the head. You can hone your skills in jiu-jitsu and wrestling and other factors that are going to make you really well-rounded. And then when you get to 18, then you can pick up the boxing element of it and get more into the headshot contact. I actually think it's a really good idea, to be honest.
Yeah, well, I'm glad that you had that take on it. That's fascinating stuff as well about the skill deficit or not having a deficit in hockey, because I think that's what a lot of people would be concerned about. Although the target area from the head to the chest, not a great distance. So it's nice to be able to come up with another example and say, look, I don't think it's going to really impact your long-term future in this if you're not getting punched in the face from 16 as opposed to 18. So yeah, that's really interesting.
Right. And it may encourage people to stay in the sport longer.
I hope
right?
so.
If I'm 16 years old and I really enjoy it, but now I'm getting knocked out, I'm done.
Yeah.
Right? Maybe allowing a little bit more brain development to occur before we start doing this. Maybe we reduce the incidence of neurodegenerative issues. Maybe we reduce the risks around CTE. Maybe we allow athletes to continue with the sport for longer because they're able to, I think it's all around probably a positive.
One other area, again, I'm not sure how specific this is and whether it's within the area of your research, but we have a huge culture of weight management and weight cutting in our sports. And guys like me talk not from a place of education where dehydration, susceptibility to the knockouts, rehydration protocols, susceptibility to the knockouts. Perhaps you might be able to fill in a couple of gaps there to give us a more scientific angle, but you're doing such a great job with your analogies. You might be able to put it in terms that we can all understand.
So there's no evidence that I'm aware of around weight cutting and dehydration and concussion risk.
Right.
But what there is and what we do know is that it does affect your cognitive ability. It does affect when you're in a weight cutting situation or you're dehydrated. One of the times that we say don't run baselines during this time because you're going to get an inaccurate result is when people are cutting weight. And there's been studies done on wrestlers that are trying to make weight. When they do a bunch of baselines on them, their performance is terrible. So then the question is, what does that process and how does that lead into the fight? Do you have enough rehydration time to get yourself, yes, you're back up to weight, but has that actually incorporated into your cellular tissues and are you actually back to kind of full capacity? That's the question. So maybe it increases concussion risk from just a performance perspective in those instances. I'm not sure. Like, how much time do you have before weigh-in to fight?
It's a rough 24 hours.
Right. So is that enough time to completely rehydrate everything you've lost and get everything into the cells and get your systems firing on all cylinders? Maybe if there was a bigger delay, maybe you make it a week. I don't know. Maybe that helps. I'm not sure, but there's no evidence to show that it increases your concussion risk as far as I'm aware.
Okay.
But we do know that it does decrease performance.
Right. One for all of us that are looking to improve our brain health. Are there behaviours, things we can do, things we can eat, which will certainly improve matters, grey matters, should I say?
Yeah, I mean, this is a whole topic on its own. Now, this is not my expertise. I actually have a guy that I lean on quite heavily for this, but I've heard him talk enough about it that I can speak with, enough information to be dangerous, I guess you could say.
Right.
But there's a bunch of things. Like if I'm an athlete, particularly in a combat sports setting, I'm going to want to do everything I can to keep my inflammatory levels low. So, and a lot of that has to do with gut. It also has to do with diet. So things that are pro-inflammatory are processed foods, things that have, refined carbohydrates like breads and things like that, are pro-inflammatory. Sugars, if you're eating a lot of processed sugars and, drinking soda pop and whatever else, those are going to be very high kind of on the inflammatory side of things. So you want to try and take like a really good nutrition perspective. So high quality protein, good fats, fruits and vegetables, stay away from anything in a box. And that's kind of your foundational diet. But then you want to make sure you're really good on omega-3s, for example. Like if you don't eat a ton of fish, then you want to be high on your good quality omega-3s. Just because omega-3s and omega-6s tend to compete for the same binding sites. And so if you can fill that with omega-6 or omega-3s, you're going to be much better off. That's anti-inflammatory. It's good for brain health. It's good healthy fats. Another one from a supplement perspective is creatine. So
Right.
as I mentioned, creatine or ATP deficit is kind of what drives the concussion injury. And creatine is a exogenous ATP. So creatine basically fills your ATP stores. That's what allows you to get a little bit more out of your training session, is that you have a little bit more ATP hanging around, because that's our energy molecule. And it helps the brain. It improves cognition. It improves brain function. It improves all sorts of aspects. And it's super, super safe to take. But also in the event of a concussion, if you have higher ATP stores, potentially you can mitigate or even decrease the recovery time because you already have this there. Another one, speaking of electrolytes, is magnesium. So magnesium is a supplement that pretty much all athletes, no matter the sport, should be taking on the regular, because magnesium used to be something we could get through our diet, and just with modern farming practices, it's been kind of leached from the soil, so we don't have it as in high concentrations in our food anymore.
Right.
So it's one thing that most athletes are deficient in because we also sweat it out.
Right.
And magnesium actually blocks the mechanism in which this happens basically is that when that electrical storm happens inside the brain, you have this release of a compound called glutamate. Glutamate binds to this receptor that allows calcium to come flooding into the cell. Calcium is what reduces our mitochondrial function and reduces our ATP. So calcium and magnesium compete for this binding center. So magnesium can actually help to potentially block calcium uptake, which means you have less disruption in the event of a concussion. So most athletes are deficient in magnesium. Magnesium is obviously beneficial for function and calming the nervous system and doing all sorts of good stuff. But it also potentially could block the amount of calcium uptake during a concussion and thereby actually improve recovery and outcomes as well. So magnesium would be another big one. So it's focusing on keeping inflammation low, right? It's kind of like, I don't know if you've heard of the Tom Brady diet, but he was very big on inflammation. He wouldn't even eat strawberries because of the amount of chemicals that were in them. So he's very, very, low inflammation kind of way of eating. Then it's fish oils, creatine, magnesium, and you've hit some major components there.
Right.
And then just in terms of function, I think athletic activity is great. So exercise, pushing yourself, all that stuff is really good for brain function. It's good for vascular flow. It's good for, a whole bunch of different things, cognitive function in the long run. Keeping yourself active even beyond your career. So that's another thing. What we find in the CTE literature, for example, is that athletes who remain active have very little cognitive decline, but athletes who become sedentary have a lot of cognitive decline.
Gotcha.
So is this a concussion issue or is this a lifestyle issue? You have to kind of think about that. And then there's actually some emerging evidence for like cognitive function and just keeping your brain active. Like there was a study that just came out on like Lumosity and just doing kind of brain. Yeah.
I have that app. I actually
Yeah.
do.
Just
I actually do that.
doing brain games and stuff. The narrative around Lumosity was always that, well, you're just getting better at the games, and that doesn't actually translate into better cognitive function. But there was a recent study that actually found that it does.
Oh, that's good.
So that's something that's easy that people can do for cognitive function. Doing crosswords, Sudokus, and socializing. Right, hanging with friends, it's good to uplift your mood. People need that social connection, and especially as men, and we become very socially isolated as we age. And I think it's important to remain social and remain with friends and family, because it keeps your mind sharp and activated when you're having conversations and doing things like that. So there's a bunch of different perspectives, but those are the kind of easy, low-hanging fruit that everyone can easily implement.
Thank you for that. Just one more thing on magnesium, because they're different types, right? Or is it just for the sleep? Some say, have this magnesium strain or whatever it is for sleep. So just to be totally clear on that, is it any magnesium for this purpose?
Yeah, that's a good question. So I'm not really up on all the types necessarily, but I know the one you want to avoid is magnesium oxide. So
Right.
if you're getting your magnesium from, just some off-the-shelf kind of generic, magnesium, look at the type on the back. It'll say magnesium oxide.
Right.
That essentially it's a very poor quality. It doesn't really make it to the brain. It basically causes it's almost like a stool softener in a way, because
Right.
it just pulls everything to your gut.
Right.
So magnesium oxide you want to avoid. And then there's certain types that have different kind of functions. And like, again, this isn't really my domain. I usually offload this to our naturopath. But like, for example, I take glycinate. Sometimes I take citrate. Sometimes I take malate. I kind of mix up the different types. But I know there's some that are better for sleep. There's some that are better able to cross the blood-brain barrier. There's some that are better for relaxation and that type of stuff. So
Yeah.
I don't want to. I can't remember exactly which one,
Do
but the one you want to
research.
avoid is oxide.
Gotcha.
Right? Glycinate, malate, citrate. I think you can't really go too wrong with that.
This is an important conversation. Have I asked all the right questions? Am I missing anything before I let you get on with your day?
No, I can't. I can't really think of anything.
Okay.
I'm sure something will pop up after this.
I'm sure. No, this is obviously a very wide field, and it's progressing, growing, thankfully, at a fast rate as well. But with that, what is with your work specifically? Like, what's the first port of call that people are interested in engaging with you a little bit more and your services? Where should they go?
If you want to follow me on social media, it's at concussion_doc. I mostly hang out on Instagram. So at concussion_doc is my Instagram handle. If you're looking for a clinic, right, if you wanted to do baseline testing, or if you had a concussion and you want some treatment on that, we do a lot of concussion rehab and we help improve outcomes. If you go to completeconcussions.com, there's a map there. You can just click find a clinic and it'll show you all of our clinics. We have 450 around the world. And if you are an athlete just looking to get some baseline metrics, or if you're an older person that's had a few concussions in your life and you want to know where you stack up, just download the Concussion Tracker app. It's completely free. And then there's a test on there. You make an account. And then there's a test on there called neurocognitive test. Do the neurocognitive test. This test is actually the most sensitive test that's on the market for cognitive function around concussion. And it was developed in part by the U.S. military. And so it's a super well-researched, well-validated tool. We license it and we give it away for free. So we pay for it, you get it for free. And you can do the test and see kind of where your levels are. So if you have some concern around aging and cognitive function, whatever, you can do that. Or if you're just an athlete that wants to get something down, you can do that. If you want the more fulsome baseline, you can find a clinic. If you don't have one in your area, just use the application. And those that are having symptoms and they're not recovering and things aren't going well, and you can't find a clinic in your area, we have another online program called the Concussion Fix. If you just Google Concussion Fix, it's an online program. We have about 1,500 people from around the world that are currently in that right now. And it's myself, our naturopathic doctor, and a psychotherapist that walk you through like a step-by-step process for getting rid of your persistent symptoms. So another thing people don't really get is that concussion is actually a treatable thing. If you have ongoing symptoms, we can actually treat that. You can fix that. A lot of people are just told, well, there's nothing you can do. You got to get, this is your new normal. Just get used to it. Learn to live with it. all that stuff is bullshit. I'm sorry if I can't say that, but
No, you can.
it's all yeah, good. It's all bullshit. You can actually treat it, and it's quite simple. All you need to do is make a few lifestyle changes. So we just teach you kind of how to do that and how to systematically reduce that. So if you go to Concussion Fix on Google, the website's different. It's my Instagram handle is Concussion Doc, so it's concussiondoc.io is the website for the Concussion Fix. So there's a bunch of different things. Anyone anywhere in the concussion field, whether you haven't had one yet and you're worried about it, or if you've had a bunch and you're worried about it, or you have ongoing symptoms, like there's a solution for you.
Yeah, wonderful. Thank you so much for your time. This has been really enlightening, and it's an important conversation as well. I know that people are going to take a lot from this, so thank you again.